Have you ever felt like the line between your mind's world and the real world is fading? Ever wondered if the thoughts running through your mind or the things you see aren't actually real? Do these thoughts scare you or make you curious? If yes, then you should stay with us in this video, because this video is definitely for you. Today, we're diving into a mental health topic called schizoaffective disorder. It's a term not many are familiar with, but it's important to understand. Let's break it down together and make it as simple as possible. Firstly, we will look into what is this, how many types are there, what are the symptoms, what causes it, how can it be prevented, how is it diagnosed, what are the treatment options, and finally, the conclusion. First, we will understand what is schizoaffective disorder. Let's see. Schizoaffective disorder is a mental health condition that mixes symptoms of schizophrenia, like hallucinations or delusions, with mood disorder symptoms, such as depression or mania. Think of it as a combination of two major issues. One affects how you interpret reality, and the other affects how you feel emotionally. I hope you now have a bit of an idea about schizoaffective disorder. Let's move on to the next point where we will learn about its types. Let's look at its types and understand them one by one. There are two main types of schizoaffective disorder. First, bipolar type. This type means a person experiences emotions that are very high, such as extreme happiness or agitation, known as mania, as well as very low, such as sadness or depression. Second, depressive type. Here, a person experiences only the depressive symptoms, like feeling very sad, losing interest in enjoyable activities, and having low energy. These types tell us what kind of mood issues someone is dealing with, along with their schizophrenic symptoms. Friends, these were some of the common types of schizoaffective disorder. Now let's move to the next point, where we will learn about its symptoms. Schizoaffective disorder has many symptoms, but in this video, we have covered some common ones. Here are a few common symptoms of schizophrenia. People with schizoaffective disorder show a mix of symptoms, including such as hallucinations. This is when a person sees or hears things that aren't really there, like hearing a voice calling their name when no one is around. It can be very convincing and real to the person experiencing it. Next, delusions. These are false beliefs that a person holds strongly, even when they are shown proof that their beliefs aren't true. For example, they might think they are a famous personality, or that they have secret powers. Next, disorganized thinking. In this case, a person's thoughts are jumbled, and they jump from one idea to another with no logical connection. This makes their speech hard to follow, and their actions unpredictable. Next, depressed mood. This means feeling very sad, empty, or hopeless for a long period, not just a bad day or two. It can stop them from finding pleasure in anything and can make everything seem bleak. Next, manic behavior. Mania involves extremely high energy levels, where someone might talk nonstop, make grand plans, or show irritability without much cause. They may feel overly happy or on edge almost all the time. So friends, those were some common symptoms of schizoaffective disorder. If you have information about any other symptoms, please write them in the comment box. Now let's move on to the next point. What are the causes of schizoaffective disorder? Let's see. The exact causes of schizoaffective disorder aren't fully understood. It's thought to be a mix of genetic factors, meaning it can run in families, brain chemistry, and environmental influences like stress or major life changes. There's no single reason. It's likely a combination of many factors. These were some common causes. Now let's move on to the important points, where we will learn how it is treated. Schizoaffective disorder can be treated in several ways. Let's see. Treating schizoaffective disorder involves a combination of, such as medications. These usually include antipsychotics for schizophrenia symptoms and mood stabilizers, or antidepressants for mood disorder symptoms. Next, psychotherapy, talking therapies, like cognitive behavioral therapy, which help with managing symptoms, understanding the condition, and dealing with everyday life. Next, lifestyle changes and support, including regular exercise, a healthy diet, joining support groups, and educating family and friends about the condition. Treatment plans are tailored to each person so they can lead a stable, fulfilling life. Friends, these were the methods to treat schizophrenia. If you feel any point was missing in this video, please do let us know in the comments section. Finally, let's look at the conclusion. Schizoaffective disorder is complex but manageable with the right treatment and support. Understanding more about this condition can help decrease the stigma around it and encourage those affected to seek help. If you think you or someone you know might be experiencing these symptoms, talking to a healthcare provider is a crucial first step. Thank you for watching, and please remember, you're not alone in this journey. Don't forget to like, comment, subscribe, and click that notification bell so you don't miss our future videos. We will meet again in the next video. Until then, stay happy and take care of yourself. Thank you.